Today, we are talking about something most women experience, but almost no one talks about the pelvic floor health. After 35, after babies, in real life. What I know so many women are quietly wondering is this normal? Why do I sneeze and I have to quick cross my legs? Like, is this a second nature? Jumping sometimes, I have to check myself. Did I do a little bit of a pee here? This conversation is long overdue, and I'm really excited to have it today. Our guest is Dr. Courtney Trocinski. She is a pelvic health occupational therapist, a birth doula, and a childbirth educator. And she is the founder of On Your Pelvic Health, a pelvic floor therapy clinic in Denver, specializing in women's health across the lifespan. In addition to her clinical work, Courtney attends birth and she's passionate about educating the community on pelvic health and women's wellness. She leads a team of OTs and PTs and a birth doulas and recently found something very exciting, a nonprofit dedicated providing financial support for women who otherwise could not access to pelvic floor therapy. This is wonderful, and thank you for that. This is a conversation that every woman needs to hear. Welcome to the Call podcast, Courtney. We're excited to have you here.
Thank you so much. I'm super excited to be here.
From your perspective, what are women actually experience that they are not seeing out in line? I find fascinating that pelvic floor is one of the most researchable topics during late night, and there is so minimal discussion around. It's almost a secret, maybe an embarrassment. Help us. What's happening?
Yeah. So I think it's better than it used to be with social media, with the internet. I think more people are starting to talk about it, but it definitely is. We see people at our clinic every day that are embarrassed about what's going on. They feel like they're the only one. They haven't talked to their friends about what's going on. The most common things I'd say we see are leaking. So when someone's coughing, sneezing, laughing, jumping, having a little bit of leakage, not jumping on the trampoline with their kiddos or not going for the run because they're worried they might leak, even a little bit of like gas or stool incontinence also. So that's something very common. Another very common thing we see is pelvic organ prolapse, where there's a little bit of descent of one of the pelvic organs, so the bladder, the uterus, or the rectum. People can feel like a heaviness or a bulging in the vaginal canal. It's super uncomfortable. If you Google it, you can go down a terrible rabbit hole spiral. It's something that most people are not talking about. And then pain with intimacy, pain with sexual intercourse is one of the most common things that we find people will come in for another symptom, whether it's the incontinence or prolapse or just general pelvic pain. And then it'll come up that they've also had pain with sex for often a really long time and they've not really talked about it. Or maybe they brought it up to their OBGYN and they were kind of like, this is life, have a glass of wine and push through. And so I think those are probably the most common things that we see. And often people don't realize that all of these symptoms are connected, and just general hip, back, pelvic pain are super common as women age, and they don't realize the involvement that the pelvic floor has in those symptoms.
This is big because I hear that all the time about women leaking, feeling the pressure, avoiding workouts, pain during sex. Walk us through what are the most common symptoms that you see in women over 35 or actually after
Yeah.
postpartum?
Yeah. So right now at our clinic, I'd say the majority of people we see are in their like mid to later 30s, definitely. A lot of women are having babies later. And so we actually see that they go from postpartum into perimenopause. And a lot of people don't realize that perimenopause can start late 30s, early 40s. Perimenopause is that time frame that can be about a decade of the massive hormonal change that our bodies go through as we're ending those reproductive years. And menopause is actually just one day, that's the year after the last period. And so perimenopause is that time up until that happens. And so for some people, that can start in their late 30s, early 40s. And a lot of women are going from postpartum, the year or two after having a baby, straight into this wild hormonal change that happens throughout perimenopause. So hormones in general have a big influence on pelvic health symptoms. During the postpartum time frame, especially if someone's lactating, so if they're breastfeeding or if they're pumping, they have a significant drop in estrogen. And estrogen helps kind of just keep everything moving and grooving the way that it should down there. And so when there's that big drop in estrogen, and then through perimenopause, when there is significant, highs and lows of
Hmm.
estrogen, it can impact things like vaginal dryness. So people can feel maybe itchy, uncomfortable. It can lead to increased leaking or feeling like someone's going to leak. And it can also impact the elasticity of the vaginal and vulvar tissues. And so people can feel more prolapse or heaviness symptoms. And in general, it can also impact, joint integrity, bones, all the things we know about as women age and those hormonal shifts happen. Just in general, people typically feel more aches and pains also. So that's common postpartum, and then especially going into that perimenopause season of life.
So I have the same question that a lot of women have. Is this normal then?
Yeah, great question. So we have a common phrase in the pelvic health world where we say that all of these things are very common, but they're not normal. And so when we are proactive about understanding how the body changes, understanding, certain risks of developing pelvic health conditions, for example, vaginal birth, that is a risk factor in all of these pelvic health symptoms like prolapse and leaking. When we're proactive about understanding that, when we have a care team around us that can support us from the physical side, the movement side, as well as from the hormonal side, mental health side, I don't think it has to be normal. So there is a normal hormonal change that happens, certainly, but I don't think these symptoms need to be normal. And I think that we just, as women, as a society, have kind of accepted it over time that this is
Hmm.
what
Hmm.
happens when you get your period. It's painful. When you are pregnant, you're going to experience the common aches and pains. You might leak when you sneeze. And when you have a vaginal birth, you're going to have all of these symptoms. If you have a cesarean birth, you're going to have painful scar tissue. When you go through perimenopause, you're just going to experience these things. And we know, because not everybody does, that there are ways to be proactive and even reactive about it once it's already happening. But we're big on being proactive about it and
Hmm.
helping prevent symptoms from starting, and then from minimizing them as they move along.
I love the word proactive. So when you say proactive, who thinks about pelvic floor, they automatically think I need to do more kegels. Can we talk about that? Is that the answer? Does that really help or that can actually hurt me? Can you explain a little bit more because there's so much out there? Let's talk about kegels and the pelvic
Yeah.
floor.
Yes, definitely. So when it comes to pelvic health, I like to think about the pelvic floor muscles like a trampoline. So a healthy muscle needs to be able to fully contract and fully relax. So if you think about a trampoline, it has kind of a nice resting tone. You're able to bounce on it and it comes back up. The pelvic floor muscles work similarly, where, when there are changes in pressure in our body, so just moving throughout the day, but also bigger pressures like sneezing, laughing, coughing, jumping, that pressure that happens naturally causes the pelvic floor to descend to accommodate for that change in pressure. So it needs to have a little bit of give to it. It also needs to be able to spring back up. So when we think about like general pelvic health wellness, pelvic floor muscle strength, we want muscles that can fully contract and fully relax. When we think about kegels, that is essentially a pelvic floor contraction. So thinking about drawing up those muscles, almost like if you were to stop the flow of urine or like hold gas in, there's a natural contraction that our body does to hold the stool and the urine in. And that's a Kegel. And so we often focus on that. And I think just as women, we're often socialized to like keep it tight, suck in our tummies, be small. And so a lot of us just naturally actually hold tension in that part of our body without realizing it. And that part of our body is something that responds to stress and anxiety and that fight or flight response. So when we are anxious or chronically stressed, our bodies kind of hold tension in the pelvic floor. So most of us, I would say, have kind of this tension holding pattern anyway. So if you think about doing Kegels on top of that, you're kind of shortening an already short muscle, which is not the right answer for most people. So when we think about approaching strength in the pelvic floor, we like for people to have awareness of what it feels like to contract and relax. Most people aren't familiar with that relaxing sensation, that lengthening of kind of letting everything go, especially if someone has felt like maybe they might leak or like they're holding in a prolapse, things feel heavy, their body naturally is going to want to tighten and kind of hold everything in because it doesn't feel safe. And so when our approach is very much more of a functional approach, so we are rarely giving people actually just isolated pelvic floor exercises. So just to do a Kegel over and over again, because we find for most people, they want to be making sure that they can run or jump without leaking. And there's a whole body to consider there. So we're looking at the feet, the knees, the hips, the rib cage, how people are breathing. We're looking at the whole body. And maybe there's a deficit in like the range of motion at the foot, not necessarily a deficit at the pelvic floor. And so doing a bunch of pelvic floor contractions doesn't necessarily help if someone needs to work on what's going on at the foot and the ankle, especially for things like running and jumping. So our treatment is a bit more functional in the sense that we're looking at the whole body. We're looking at maybe where things are kind of breaking down the chain. And a lot of times the pelvic floor is just where people are noticing it. So they're noticing the leaking or the heaviness or the discomfort. But long story short, we rarely recommend just isolated Kegels for anyone. It's nice to have an awareness of what the pelvic floor is doing, but we need both that contraction and the relaxation. And more importantly, we need it to work within the whole system. And so we do a lot more work with, the rest of the body.
Well, thanks for the clarity. I think we all need to hear that. Kegel is not always the solely answer. And I love that it's a holistic approach with the whole body, making sure you can find some muscle imbalances around the body.
Mhm.
That's very enlightening, and we don't get to hear that very often. So thank you for that.
Yeah.
Now we can transition. We talk about Kegel. So what should women should be doing in their workouts to support the pelvic floor? And what are the biggest mistakes that you see?
Yeah, great question. It's tough to give a blanket answer just because everybody is so different and everybody has kind of a different background, different injuries, different, if someone's been through a pregnancy, childbirth, there are, I would say, different imbalances in different bodies. And so what one person needs to work on or focus on might be very different than someone else, even if they're two people with the same symptoms. So all that to say, my general recommendations tend to start with a combination of different movement. So I find that the people that really love to get their heart rate up, they really love to do HIIT, or they go running, or they really like the cardio, they often don't love slowing down, yoga, meditation, breathing, and vice versa, right?
That's
I
me.
find, yes, we all have our preferences. And I find that having a mixture really helps the body be able to do both things because we do need to be able to respond suddenly and maybe, chase a kid across the road or,
Right.
respond quickly. But we also need to know how to slow down in order to allow for, normal digestion, normal like elimination of stool and urine. Our bodies need to know how to relax and let go. So I tend to recommend a balance of if you really love the HIIT, also try some yoga and vice versa. And especially as women are aging, there's so much more research coming out now about strength training. And there's pros and cons to social media and our age of the internet. But for the most part, I think it's getting out there that women more than men really need to focus on loading the body and strength training. And we're not fragile. And especially around pregnancy, postpartum, perimenopause, there's almost a hesitation of like, oh, I can't lift that heavy, or my doctor told me I can't lift that heavy. And, nobody needs to start with hundreds of pounds.
Progression.
But, more than body weight is really for a lot of people highly recommended. And I see strength training as one of the more protective mechanisms for preventing and minimizing pelvic health symptoms. When people feel stronger, they're more confident in moving their bodies. So strength training is a huge component. And in general, I tend to recommend that everybody go see a pelvic floor therapist at some point, even if they're not having symptoms, just to understand how their breath works, how pressure management in the core works, and how someone can support their pelvic health, and how certain habits they have might be detrimental over time, and how they can optimize, certain breathing techniques or strategies, especially while they're working out, to optimize pelvic health rather than, maybe be putting themselves at risk in the future. But in general, I would say breath work, see a pelvic floor therapist, and mixing it up. So doing a variety of exercise movement.
My next question is like, if women, someone who has very limited time, almost to the point that, every time I sneeze, I leak, this is normal, this is part of who I am, I accept, I'm aging. What do you tell this person? How do you approach this person to educate, or I don't want to use the wrong words, but to say like, that's not normal.
Yeah.
We can fix this. You shouldn't be feeling like that. What is your
Yeah.
approach? What would you tell this person?
Yeah. I see a lot. I mean, I feel like just women in general tend to put themselves last, especially when they have families, especially when kiddos are young. They just get in the habit of, they come last. And so we very frequently see people who have, had certain symptoms for 10 plus years, and they're like, finally tired of it and thinking, okay, maybe I should do something about this. So one thing that I recommend, or that I let people know, is when it comes to pelvic health, symptoms rarely go away on their own. So if somebody is having leaking, if somebody's having pain with sex, we know just anecdotally and based on research that very rarely does something go away on its own. And if one symptom goes away, it tends to pop up in a different way down the road. So even if people are feeling fine in that like postpartum stage of life, it might be, 5-10 years later as they're going through perimenopause that things come up again. So one, we like to just educate that symptoms rarely go away on their own, and that they don't need to be put up with. So, not running or avoiding certain movement because you're nervous about leaking is incredibly detrimental to just like quality of life and mental health. So we recommend that even if it's small steps, that people start to take them as early as they feel these symptoms. And that they tend to get better faster, right? If you've had something going on for a couple of weeks and you're nervous about it, what it means, and we start to work on it then, it's going to be a much shorter rehab process than if somebody's coming to us 10 years later and they've been having all of these symptoms for a while. And I would say, too, the way that our clinic specifically works is that it's meant to fit into life. So we know that most people do not have, hours on end to dedicate to a certain movement. And so it's really little habits here and there of like, can we work on this breathing strategy when you're waiting to pick up your kid at school? You're in the car line and you have 5 minutes there. Can we do this certain movement while you're brushing your teeth at night? Can we do some cupping in the shower to improve like breath and rib mobility while you're already in the shower? You're not adding time to your day. So there are a lot of ways to build in certain habits to promote optimal pelvic health without, adding hours on end each day for rehab. And I think a lot of people are familiar with like going to a rehab professional, so a PT or an OT, and getting 3 sets of 10 of, 10 different exercises to do every day. And nobody's doing that. And we know that. And so the way that we work specifically is building rehab into people's lives so that they're actually, making change and their habits and routines are changing so that they're actually getting better. So again, a long answer, but I would say that things are not going to get better on their own. And they are not alone. And it's not something that they should deal with because it is going to significantly change the trajectory of someone's life, of how they choose to move, of travel they choose to do, of how they choose to interact with, the world. So we see a lot of people later in life who are, scared to leave their house because they're, having urinary urgency and they don't know where the bathroom is. So they're not going out with friends and they're not doing things that they want to do. So there's a lot of ways that pelvic health symptoms, they don't get better and they often get worse and they significantly impact quality of life.
Oh, that's incredible. And again, for women out there with pelvic floor issues, there is a light in the end of the tunnel. You do not need hours and hours of your time to get these issues resolved. As you heard Dr. Trocinski, just a couple of exercise. Try to see your pelvic floor therapist. She can help. Don't be the person who thinks that's normal. And I think that's the conversation that we have. We need to stop normalizing what's not normal. That's why, again, I'm grateful for you to be here. We need to have those discussions, which leads to another discussion. Women don't really want to talk about this, but I hear whispering here and there. And sometimes they have pain during sex. And it's stuff like, what is wrong with me? Can we talk about the pelvic floor health and the impact on intimacy?
Yeah, definitely. That is a big one. And just, I feel like one statistic that always sticks with me is, for women who have had childbirth, 90% of them will have pain with intimacy the first time they return to intimacy. Of those people, upwards of, 60, 75% that have pain then will still have pain a year later. So it's one of those things that, like I mentioned, it's not going to get better on its own. And a lot of people feel like they need to just rip the Band-Aid off, keep pushing through it. But the body doesn't work that way. I mentioned, postpartum, return to intimacy, because that's a big thing that we see. But for a lot of people, they've just really never enjoyed sex, or they have a different libido than their partner, or they're, they have a lot of shame around it. And it's something that they just kind of push through on a regular basis. And we find that it's kind of more about our understanding of female anatomy, female arousal, and that female anatomy and male anatomy need very different things to have pleasure with intimacy. And so, just thinking about general intimacy with penetrative sex, thinking about female anatomy and male anatomy, most of us understand how male anatomy works, and that's what sex is. And women kind of just fit themselves into that mold of, this is what a male partner needs, and this is almost like I come second. And so part of it, I feel like, is that a lot of women actually don't understand their own bodies. There's shame about it. They've never really looked or touched or self-explored on their own. And so they don't even know what they want. So for a lot of women who have pain with intimacy, we start there, of a general, digging into their history as far as who told you that this was bad, who told you not to look, who told you not to touch, and how has your body kind of internalized that over time so that it feels bad and that your pleasure is not as important as somebody else's. So that's one big piece of it, and helping people just feel comfortable exploring their bodies again. And then being able to have the conversation. A lot of people are not comfortable talking about it with a partner. A lot of the partners don't know that the female partner is uncomfortable or having pain or not enjoying it. And for a lot of people, I find that that's the case ahead of children, and then they have children, and then postpartum, there's even less communication about it, but it's a bigger issue because it's more uncomfortable. And then
Mhm.
life just goes on unless they do something about it. So we often recommend, if there's a partner situation of like seeing a sex therapist or mental health therapist that specializes in sexuality together, to be able to talk through the relational parts of it. But in general, I find it starts with just our understanding of female anatomy and female arousal. And then the physical piece of it, of like a lot of women have tension in those pelvic floor muscles. And if you think about muscles that are holding on kind of tight, they wrap around the vaginal canal. If they're tight and we're nervous about what's to come because we have a history of pain or discomfort, those muscles are not going to want to let go. And
Mhm.
it's going to continue that spiral of being uncomfortable and painful. So when we think about pain with sex, there's general like pain with initial insertion, and then there can be pain with deeper penetration. There can also be both. And the way that we treat it is a little bit differently, but it has a lot to do with what our nervous system, what our bodies are telling us about what's to come, and kind of almost that anticipatory fear if there is already that history of discomfort and pain. But it's definitely not normal. And I mean, we've had plenty of people come through our clinic in their later 30s, 40s, 50s, 60s. And we're working on a lot of symptoms. And then, pain with sex is one of those symptoms. And they'll come back in and be like, my sex life is better than it's ever been before. Because they're finally giving time to understanding their own body, to telling their partner what they need. And the muscles are finally like able to respond to, what they're hoping for. So there are a lot of pieces when it comes to pain with intimacy. But the biggest are that I feel like understanding anatomy, understanding arousal, and if there are, if there's scar tissue at the perineum, if there's a history of surgeries, if there's a history of any kind of like shame or trauma in that area, those are certainly things to address. And then there's also the physical structures and the muscle tension to address as well.
Okay, so I think we're gonna need a second series here. I myself have so many questions, and I know we're limited on time, so I'm gonna be respectful of your time. My last question: if there is one exercise that a woman could be doing right now to strengthen their pelvic floor, what would that be?
Great question. It's a little bit different for everyone. I would say some breath work in a position where they can tune into what's happening at their pelvic floor would be my biggest recommendation. So something like a child's pose, or laying on their back with their legs in a butterfly position, or being on hands and knees, kind of a cat-cow pelvic tilting position. Taking a deep breath in, feeling on that inhale, like the breath gets all the way to the pelvic floor, noticing how the body responds on the exhale, and just tuning in. Because I feel like strength comes from first awareness, and then being able to build the strength in whatever way is necessary. But that breath work is one of the biggest things I recommend. When it comes to true strength, it kind of depends on if somebody needs to release those muscles or tighten those muscles. And so, we might recommend certain like squats or hinges, or different like lower body exercises based on what somebody needs, or core exercises. But for the most part, I recommend that everybody start with just breathing.
Okay, maybe for our next podcast, how do I know if my pelvic floor is too weak or too tight? So
That's a
stay
good one.
tuned. Final question, I promise. Um, if a woman can take one thing from our conversation today, what would that be?
I think the biggest thing I would say is that you are worth the time it takes to have optimal pelvic health. I think a lot of people don't feel like they're worth the time for whatever reason. But you're worth the time it takes to understand, your own anatomy and sexual pleasure. You're worth the time it takes to rehab your pelvic floor so that you're not leaking. You're worth the time it takes to, whatever the goal is. I would say that a lot of us have this I don't know if it's the way that we're socialized to feel like we're not as important as, other people in our family, or we kind of come last. But I would say that the biggest thing is that you're worth the time it takes to reach whatever goals you have.
I love that. Thank you. Hey, I love our conversation. I always say we're not trying to get our old bodies back. We're just trying to build a stronger one. And this is part of it. If you're in Denver and you listen to this conversation and this is something that resonates with you, where can we find Dr. Trocinski?
Yeah, so we are in Northwest Denver, just northwest of the city. Our clinic serves women throughout the lifespan, so anyone who's having any kind of pelvic health concerns. So you can reach us at 720-509-9154. Also, our website is just www.ownyourpelvichealth.com. Also on Instagram, that same Own Your Pelvic Health. And then if people are interested in, finding a pelvic floor therapist near them, there's also a couple really great directories online to search your area and find pelvic floor therapists that specialize in different diagnoses, different conditions, to find a really good fit.
Perfect. Thank you so much for being here. And thank you so much for all the callers for listening to the Call Movement podcast. This is a very, very important conversation. If this conversation resonates to you or you have a friend, please share the link. You can follow me on Instagram at Leticia Call, or you find me on YouTube at the Call Movement podcast, Leticia Call. Thank you so much for your time and see you next time.